Welcome to our Healthy Care channel, where we navigate the complexities of modern life and its impact on our well-being. In today's fast-paced world, we're surrounded by processed and fried foods loaded with excess salt and sugar. With overeating, obesity, and regular alcohol consumption on the rise, our livers are under more stress than ever, working overtime to keep us healthy. But fear not, because we're diving into the realm of liver care with a lineup of nature's own detoxifiers. While the effectiveness of so-called liver-cleansing foods can spark debate due to varying levels of scientific support, incorporating certain foods into your diet may indeed promote liver health. According to health experts like those at the Liver Foundation, steering clear of fatty foods and alcohol is key in reducing liver disease risk. Well, before we spill the beans on these liver-loving foods, make sure to subscribe to our channel and ring that notification bell so you never miss out on life-enhancing content. Now, here are 16 foods that look after your liver in the most natural way. Number 1. Grapefruit. Let's talk about grapefruit. This tangy powerhouse is not just a breakfast staple, it's a vital source of vitamin C, potassium, and fiber. But its benefits stretch far beyond its nutritional value. Studies highlighted in carcinogenesis suggest that grapefruit is a defender against specific types of liver damage. Packed with glutathione, grapefruit aids the liver in producing crucial proteins and chemicals necessary for repair and a robust immune system. Imagine, just a glass of freshly squeezed grapefruit juice not only brightens your day but also sparks the production of detoxifying enzymes. These enzymes spring into action to cleanse your body of carcinogens and various toxins, as reported by the Huffington Post. Number 2. Avocado. Avocado, the creamy and versatile superfood, is beloved by many not only for its delightful taste but also for its impressive health benefits. It's a culinary chameleon that can enhance nearly any dish. But did you know that avocados are also powerful liver protectants? Research from the American Chemical Society shows that avocados are packed with chemicals that can significantly reduce liver damage. They're nutrient-dense powerhouses that assist the body in synthesizing glutathione, a compound essential for detoxifying the liver, as pointed out by holistic nutritionist Amit Sareen. Plus, avocados are rich in vitamins C and E, which work together as potent antioxidants to shield the liver's cells from damage. Number 3. Berries. Bursting onto the scene of liver health are berries, small in size but mighty in benefits. Notably, blueberries and cranberries are laden with anthocyanins, the antioxidants that not only give them their vibrant colors but also pack a powerful health punch. Highlighted in a study for the World Journal of Gastroenterology, these antioxidants are champions in exhibiting anti-carcinogenic and anti-inflammatory actions. Number 4. Lemons and limes. Lemons and limes take center stage as the tangy detox duo, loaded with the cleansing power of vitamin C. This vital nutrient aids the body in transforming toxic materials into water-soluble substances, easing their elimination. Intriguingly, a study in Biomed Research International has shed light on the positive effects lemon juice has on alcohol-induced liver damage, at least in the mouse model. Starting your day with a glass of fresh lemon or lime juice not only refreshes your palate but also wakes up your liver, encouraging it to cleanse itself and work more efficiently. Number 5. Whole grains. Whole grains are an essential player in the quest for liver health. A study published in the International Journal of Endocrinology presents compelling evidence. Diets rich in whole grains are linked with a lower risk of comorbidities associated with non-alcoholic fatty liver disease, NAFLD. These grains come packed with fiber, which not only aids digestion but also helps manage blood sugar levels, reducing the liver's workload and helping to prevent the buildup of fat. So, by choosing whole grains over their refined counterparts, you're not just indulging in a hearty texture and nutty flavors, you're also making a wise investment in your liver's health. Number 6. Apples. Apples have long been touted as a go-to for healthful snacking. In a fascinating study from the University of Iowa, researchers discovered a hidden hero within apple skins, oxalic acid. This compound plays a significant role in combating liver issues related to obesity. Mice that were fed oxalic acid avoided the onset of obesity-related liver disease, despite their high-calorie intake. This finding suggests that incorporating apples, especially with their skins on, into your diet could offer a protective effect against liver complications. Number 7. Garlic. Garlic, with its potent aroma and flavor, is not just a culinary favorite but also a boon for liver health. Holistic nutritionist Hermit Sari highlighted to the Huffington Post the extraordinary ability of garlic to activate liver enzymes, crucial for maintaining a well-functioning liver. Even in small amounts, garlic is mighty, packed with significant levels of allicin and selenium, two potent natural compounds adept at aiding liver cleansing processes. Beyond these, garlic is also rich in vitamin B6, as noted by SF Gate, which serves as an anti-inflammatory, and its amino acids aid in blood vessel relaxation. Number 8. Broccoli and cauliflower. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are not only nutrient-dense but also powerful liver protectors. Research highlighted in the Journal of Food Science and the World Journal of Gastroenterology underscores the significant role these vegetables play in liver health. These studies reveal that broccoli and cauliflower help shield the liver from damage and boost the production of detoxifying enzymes within the organ. This enhances the liver's ability to process and eliminate toxins more efficiently. Number 9. Turmeric. Turmeric isn't just a vibrant spice that adds flavor and color to your meals, it's also a formidable ally for your liver. Known for its powerful anti-inflammatory and antioxidant properties, turmeric plays a crucial role in liver health. It enhances the liver's detoxification processes and strengthens enzymes responsible for flushing out dietary carcinogens. Research from the Indian Journal of Physiology and Pharmacology supports turmeric's beneficial impact, demonstrating that turmeric extract can significantly improve liver function by increasing its detoxification capabilities. Moreover, turmeric helps protect the bile duct, enhances bile flow, and prevents the conversion of alcohol and toxins into harmful compounds that could damage the liver. Number 10. Beets. Beets, with their deep crimson hue, are not only striking in appearance but also incredibly beneficial for liver health. According to a study published in the scientific journal Nutrients, beetroot juice has been shown to effectively reduce damage and inflammation in the liver. This makes beets a potent ally in liver care, similar to the beneficial effects observed with cruciferous vegetables. The power of beets extends to enhancing the liver's detoxification processes. Beet juice boosts the level of detoxifying enzymes in the liver, helping to clear out toxins more efficiently and protect against liver damage. Whether juiced or cooked, incorporating beets into your diet can significantly aid in maintaining a healthy liver. Number 11. Leafy green vegetables. Leafy greens such as spinach, kale, and arugula are not just staples for a healthy diet, they are also formidable detoxifiers for your liver. Dr. Frank Lipman, in an article from mindbodygreen.com, highlights the extraordinary abilities of these greens, which are packed with plant chlorophylls. These chlorophylls have the unique capability to neutralize heavy metals, pesticides, and harmful chemicals from the bloodstream, making them crucial for those looking to cleanse their liver. Leafy greens are incredibly versatile in preparation, which makes them easy to incorporate into your daily diet. Whether you choose to consume them raw in salads, cooked in various dishes, or juiced, they offer a simple yet effective way to support your liver's health and overall well-being. Number 12. Green tea. Green tea, renowned for its soothing qualities and health benefits, is especially cherished by the liver. A study published in Nutrition and Cancer indicates that increasing your intake of green tea could potentially serve as a preventative measure against liver cancer. The secret to green tea's effectiveness lies in its rich content of plant antioxidants known as catechins. These powerful compounds are known to enhance liver function and provide a host of other health benefits. However, while green tea in its brewed form is beneficial, it's crucial to be cautious with green tea extract. Research has indicated that, in contrast to the beverage, the extract form can sometimes have adverse effects on the liver. Number 13. Nuts. Nuts are not just a tasty snack, they are also potent allies in the fight against liver disease. A study published in the World Journal of Gastroenterology highlights nuts as having therapeutic potential for treating non-alcoholic fatty liver disease, NAFLD. Rich in healthy fats, nutrients, vitamin E, and beneficial plant compounds, nuts offer a comprehensive package of benefits for liver health. Including nuts in your diet has been associated with improved liver enzyme levels, which are crucial for maintaining liver function. Nuts support the liver's natural cleansing processes and provide essential unsaturated fats. These healthy fats help prevent the accumulation of fat in the liver and strengthen the cell membranes of liver cells, enhancing their resilience and function. Number 14. Oily fish. Oily fish such as salmon, mackerel, and sardines are renowned for their high content of omega-3 polyunsaturated fatty acids. These essential nutrients are a boon for liver health, as evidenced by a study published in the World Journal of Gastroenterology. The study revealed that omega-3s in oily fish not only reduce lipid accumulation in the liver but also lower liver enzyme levels, improve insulin sensitivity, and exert anti-inflammatory effects. These benefits make oily fish an invaluable addition to a diet aimed at maintaining or improving liver health. The omega-3 fatty acids help combat inflammation, a key factor in many chronic liver conditions, and aid in preventing the buildup of excess fats in the liver, thereby supporting overall liver function and health. Incorporating oily fish into your diet a few times a week can provide these critical nutrients and help keep your liver in top shape. Number 15. Coffee. Coffee, a beloved morning ritual for many, is more than just a comforting beverage. Regular consumption of coffee has been linked to significant liver health benefits, particularly in combating liver diseases. According to research in the Journal of Gastroenterology and Hepatology, drinking coffee can reduce the prevalence of non-alcoholic fatty liver disease, NAFLD, and inflammation associated with non-alcoholic steatohepatitis, NASH. Further supporting coffee's liver protective properties, a study in the Journal of Clinical Gastroenterology demonstrated that coffee consumption is associated with a decreased risk of developing cirrhosis and hepatocellular carcinoma, the most common type of liver cancer. These findings highlight coffee's potential role in both preventing and mitigating the progression of serious liver conditions. For those looking to support their liver health, adding a cup or two of coffee to your daily routine might be beneficial. Number 16. Water. Water is often overlooked for its simplicity, yet it is crucial for the overall health and optimal functioning of our bodies, including the liver. Staying well hydrated is not only vital for basic bodily functions but also plays a significant role in maintaining liver health. According to liversupport.com, drinking sufficient water throughout the day supports the liver by thinning the blood, which helps in the efficient processing and removal of toxins. Additionally, proper hydration is key in maintaining a healthy weight and aiding digestion, both of which alleviate unnecessary stress on the liver. Making sure to drink enough water daily is a simple yet effective way to keep your liver in good condition, promoting better health and well-being. It's a fundamental yet powerful step in any health regimen, underscoring the importance of hydration for liver functionality. Easy Liver Cleanse. Discover the 1 cup a day solution to reduce liver fat. The liver, often underestimated, plays a pivotal role in maintaining our health. It's imperative to recognize that a substantial portion of the population is afflicted with fatty liver disease, a condition often undiagnosed until revealed through imaging techniques like ultrasound or CAT scans. This revelation usually comes as a surprise to many. Understanding the liver's functions and the significance of reducing hepatic fat is crucial. There are simple yet effective strategies that one can employ to mitigate this issue, including dietary interventions. I'll discuss a specific concoction that can be prepared daily to aid in this process, underpinned by solid scientific evidence. Relevant resources and detailed explanations of each ingredient will be provided for further understanding. A common misconception is that bile, essential for the digestive process, is produced by the gallbladder. In reality, the liver is responsible for bile production, with the gallbladder merely storing it. Bile's role is vital. It acts as a detergent, facilitating the breakdown of fats. This process is more intricate than it appears. For instance, consider the digestion of dietary fats. Once consumed, these fats pass through the stomach and into the small intestine. While the stomach initiates the breakdown, the gallbladder aids this process by releasing bile. Bile, in turn, prepares the fats for further breakdown by pancreatic enzymes, particularly lipase. This enzyme, specialized for fat digestion, requires bile's assistance to effectively perform its function. Bile increases the surface area of fats, allowing lipase to more efficiently catalyze their digestion, facilitating better nutrient absorption in the small intestine. Inadequate bile production impairs this process, leading to nutritional deficiencies. For example, a deficiency in vitamin A, first manifesting as night blindness, can be a direct consequence. Difficulty in seeing under low light conditions, such as during nighttime driving in the rain, can be an early indicator. Beyond vision, vitamin A plays a crucial role in immune function, particularly in combating sinus issues. Similarly, a lack of vitamin E can adversely affect heart health, potentially leading to increased inflammation, arterial calcification, and elevated cholesterol levels. These symptoms should not be underestimated, as they can signify broader health issues. Vitamin D deficiency, another potential outcome of inadequate bile production, can have far-reaching consequences. This vitamin is essential for pain reduction, blood pressure regulation, bone formation, and calcium absorption in the small intestine. Without sufficient vitamin D, calcium absorption plummets, leading to bone health issues, sleep disturbances, and other complications. Furthermore, vitamins K1 and K2 deficiencies can lead to easy bruising, bleeding issues, and calcium accumulation in arteries and joints, respectively. These vitamins play a critical role in blood clotting and calcium regulation. Lastly, the importance of omega-3 fatty acids cannot be overstated. These essential fats are vital in controlling inflammation. A deficiency can lead to various inflammatory conditions, including arthritis, heart problems, and even cognitive impairments due to their significance in brain health. In summary, the liver's health is integral to our overall well-being, influencing various aspects of our physiological functioning, from fat digestion to nutrient absorption and regulation. Its role in maintaining our health is indispensable, and it warrants our utmost attention and care. Bile, a crucial liver secretion, plays a vital role in regulating cholesterol levels in the body. For example, when someone adopts a ketogenic diet for weight loss, fat cells release triglycerides and cholesterol. While triglycerides can be utilized for energy, cholesterol cannot. Here, bile is essential in aiding the elimination of excess cholesterol. A deficiency in bile due to compromised liver function can lead to gallstones, which are essentially crystallized cholesterol formed due to insufficient bile to emulsify and break it down. Moreover, bile salts are integral in detoxifying the body. The liver's primary function is not to store toxins but to neutralize them. Without adequate bile, the body struggles to process and eliminate these toxins, leading to an increase in toxic substances circulating in the bloodstream and body. Thus, optimal liver function is paramount for effective detoxification. An enlarged liver, a symptom of fatty liver disease, can cause physical discomfort. As the liver grows heavier, it no longer fits properly in its designated space on the right side of the body, leading to pressure and pain in the neck and right shoulder, as well as a sense of fullness under the right rib cage. The liver's role extends beyond detoxification to metabolic functions, particularly in thyroid hormone conversion. It is responsible for converting T4 to T3, the active form of thyroid hormone. A dysfunctional liver may impair this conversion process, leading to suboptimal levels of T3 and potential thyroid issues, despite the presence of hormones. The liver's efficiency in this conversion process is crucial, as it handles approximately 80% of T3 activation. Additionally, the liver plays a key role in regulating sex hormones like estrogen and testosterone. An imbalance in these hormones, due to inadequate liver function, can lead to various health conditions. For instance, in women, it might contribute to polycystic ovarian syndrome, characterized by an excess of androgens, or in men, an imbalance can lead to issues like abnormal breast tissue growth and low testosterone levels. Therefore, maintaining liver health is not just about preventing gallstones or managing cholesterol, it's also about ensuring the effective functioning of numerous other bodily processes, including hormone regulation and detoxification. A healthy liver is a cornerstone of overall well-being. As a health expert, I would like to provide an enhanced perspective on the importance of bile and how to recognize symptoms of low bile production, crucial for optimal liver function and fat digestion. Firstly, difficulty in digesting fats, indicated by bloating after consuming fat-rich foods, can be a sign of inadequate bile production. Bile is essential for breaking down fats, and its insufficiency can lead to digestive discomfort. Observing stool characteristics offers valuable insights. Light-colored, pale, or gray stools, particularly if they float or leave skid marks, may indicate a bile deficiency. This is because bile imparts color to the stool and aids in fat breakdown, affecting stool consistency and buoyancy. Another symptom of low bile is a lack of satiety after meals, possibly due to inefficient fat absorption. This can lead to a persistent feeling of hunger as the body struggles to signal fullness to the brain. Common digestive issues like nausea, indigestion, and especially bloating, burping, or belching can also be indicative of low bile production. These symptoms suggest a disruption in the normal digestive process, where bile plays a pivotal role. Understanding the significance of bile extends to managing liver health, particularly in preventing fatty liver disease. Enhancing bile production can be a strategic approach to maintain liver health. Some individuals opt for purified bile salt supplements, which can support this process. In addition to dietary adjustments, I recommend a simple, nutritious shake to support liver health. This shake is particularly effective in conjunction with a ketogenic diet and intermittent fasting, which can significantly reduce liver fat. The shake's ingredients are straightforward: kale, blueberries, and kefir. These should ideally be organic and frozen for ease of blending and enhanced taste. Kale and blueberries are rich in quercetin, a potent nutrient for combating fatty liver. They also provide other beneficial compounds for liver health. To prepare, blend 2 cups of frozen kale, 1 cup of frozen blueberries, 1 cup of water, and 1 cup of plain whole-fat kefir. Avoid flavored or sweetened kefir, opt for organic, grass-fed varieties if possible. The kefir adds necessary probiotics for liver health. Once blended, this shake not only tastes great but is also highly effective in reducing liver fat. Consuming it daily, along with a healthy ketogenic diet and intermittent fasting, can significantly improve liver health and function. The liver plays a crucial role in filtering and processing harmful substances in our bodies. However, certain medications can lead to severe liver damage, and it's important for us to understand them to protect our liver health. In this video, we'll delve into these medications and provide information on the early symptoms of drug-induced liver damage. The last one is the main one, so stay until the end. This will help you recognize and respond promptly to any signs related to your liver health. The 10th medication on our list is the combination of amoxicillin with clavulanate, a widely prescribed antibiotic known for its effectiveness in treating various infections like sinusitis, tonsillitis, pneumonia, and urinary tract infections. Despite its efficacy, there's a significant concern associated with this medication. It has been linked to numerous cases of acute liver injury, a serious condition characterized by sudden liver damage that can have severe consequences if not promptly addressed. Therefore, it's crucial for healthcare professionals to be mindful of this risk when prescribing or administering amoxicillin with clavulanate. Patients should be closely monitored, especially if they're using the medication for prolonged periods or in high doses. They should also be educated about the signs of liver injury and advised to seek immediate medical attention if they experience symptoms such as jaundice, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, as these may indicate liver problems requiring urgent intervention. The 9th medication known to potentially harm the liver is diclofenac. While all anti-inflammatories, like ibuprofen and naproxen, carry a slight risk of liver damage, it's relatively rare. However, diclofenac is particularly notable for its higher risk compared to other anti-inflammatories when it comes to causing liver injuries. Liver damage from diclofenac can occur weeks or even months after starting to use the medication. Hence, it's crucial to understand that diclofenac not only affects the kidneys but also poses a risk to the liver. Stay vigilant about any symptoms and consult a healthcare professional if you experience any concerns while using this medication. The 8th medication we'll discuss is amiodarone, also known as ankerone, commonly prescribed by cardiologists to manage cardiac arrhythmias. This medication stands out for its effectiveness in significantly improving arrhythmias and even clearing 24-hour Holter records. However, it's essential to recognize that amiodarone carries one of the highest indexes of side effects among medications. It can impact various organs, including the thyroid, lungs, skin, and yes, the liver as well. Due to this extensive range of potential side effects, its usage has become more restricted compared to the past, reserved for specific cases where the benefits outweigh the risks. While amiodarone typically doesn't cause acute liver injury, it's important to note that its harmful effects on the liver may take weeks to months to manifest. Healthcare professionals and patients alike should remain vigilant for any signs of liver problems while using this medication and report any concerns promptly to their healthcare provider. The seventh group of medications that can potentially affect your liver are anticonvulsants. Specifically, medications like phenytoin, commercially known as Hydental, and valproic acid, known as Depakote, are noteworthy for their association with liver damage. Hydental has been observed to start causing liver injury immediately after initiation of treatment, while the effects of Depakote may become apparent between 1 and 6 weeks into therapy, underscoring the importance of regular monitoring of liver enzymes. In addition to these, carbamazepine and lamotrigine are also recognized for their potential to cause liver injuries, although such occurrences are much less common. Thus, individuals prescribed these anticonvulsant medications should be vigilant about any signs of liver dysfunction and ensure regular liver function tests to monitor their liver health closely. The sixth medication known to potentially cause liver injury is allopurinol. Often prescribed for individuals with elevated uric acid levels or those suffering from gout, especially when dietary modifications alone aren't sufficient to manage the condition. Allopurinol effectively lowers uric acid levels in the body, thereby preventing gout attacks. However, it's crucial to understand that allopurinol can have adverse effects on the liver. Liver injuries associated with allopurinol use can occur rapidly, sometimes within days or weeks after initiating treatment. Hence, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is essential to promptly detect any issues and adjust the treatment plan as needed. Additionally, patients should promptly report any unusual symptoms that may arise during allopurinol use to their healthcare provider. Despite these risks, it's important to note that allopurinol remains a valuable therapeutic option for many patients with gout or elevated uric acid levels. However, its usage should be managed cautiously, with close attention paid to liver health. The fifth medication of concern is methotrexate, a widely utilized treatment for various conditions including rheumatoid arthritis, psoriatic arthritis, and certain types of cancer. One crucial aspect of methotrexate use is the necessity for continuous monitoring of liver enzymes due to the common occurrence of liver injury associated with this medication. Liver injury induced by methotrexate can span from mild to severe, and in severe cases, may result in significant liver damage if not promptly identified and managed. To mitigate these risks, healthcare providers typically conduct regular liver enzyme tests for patients on methotrexate. These tests serve to promptly detect any signs of liver damage, enabling adjustments in medication or treatment strategies to prevent major complications. Adhering to medical guidelines regarding methotrexate dosage and frequency of use is paramount in minimizing the likelihood of adverse effects, including hepatic ones. In certain scenarios, depending on the patient's health status and response to treatment, healthcare providers may explore alternative therapeutic options to mitigate the risk of liver injury associated with methotrexate. The fourth category of medications that can potentially impact the liver is antifungals. Specifically, fluconazole and itraconazole, commonly employed in the treatment of candidiasis and nail mycosis, are associated with hepatotoxicity in certain susceptible individuals. Given this association, it's crucial for individuals using these medications to treat mycosis to be vigilant about recognizing signs of hepatic toxicity, as mentioned earlier. prompt identification of such symptoms can facilitate timely intervention and management to mitigate the risk of liver damage associated with antifungal therapy. The third group of medications that can impact the liver are antipsychotics, specifically risperidone and quetiapine, marketed under the name Seroquel. These antipsychotic medications are not only utilized in the treatment of psychoses but are also employed for cases of refractory depression, which refers to depressions unresponsive to conventional treatment. Both risperidone and quetiapine carry the potential to cause liver damage, primarily through a process known as drug-induced cholestasis. This condition occurs when there's an interruption or reduction in the flow of bile from the liver, crucial for fat digestion and waste elimination. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, leading to potential hepatic damage. Therefore, patients undergoing treatment with these medications should undergo careful monitoring for any signs of liver problems to ensure early detection and intervention. The second medication known to potentially affect the liver is methyldopa. Methyldopa is commonly prescribed to manage high blood pressure and is particularly favored for its safety, being the most prescribed medication for pregnant women with hypertension. Despite its overall safety profile, methyldopa has been associated with potential liver damage. As such, its use is not recommended for individuals with pre-existing liver conditions such as fibrosis or cirrhosis. It's important to note that adverse effects on the liver can manifest up to 12 weeks after initiating treatment with methyldopa. Regular monitoring of patients using this medication is crucial to promptly detect any signs of liver impairment. This monitoring helps prevent deterioration and ensures that hypertension treatment does not inadvertently harm liver health. Patients with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternative treatment options. The top drug on the list is paracetamol, which is widely recognized as the leading cause of drug-induced liver failure. Typically, liver injury isn't triggered by the standard dosage but rather by excessive doses. Unfortunately, due to its widespread availability, some individuals misuse paracetamol, taking more than the recommended amount. For instance, instead of adhering to the appropriate dosage for a headache, they might ingest 3 tablets at once, repeating this overdose pattern. It's crucial to underscore that when taken as directed, paracetamol is safe. Doctors routinely prescribe it to infants to alleviate fever or pain without encountering issues. However, surpassing the recommended dose can be perilous. Shockingly, more than a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can precipitate acute liver failure, which carries a high mortality rate and often necessitates a liver transplant if the organ fails to regenerate itself. Unlike the kidneys, where hemodialysis can sometimes reverse renal failure temporarily, the liver typically requires a transplant once compromised. Moreover, factors like alcohol consumption, genetic predisposition, and concurrent intake of other medications on the list can heighten the risk of liver injury. Liver damage from paracetamol typically initiates within 1 to 3 days following ingestion, with symptoms manifesting 2 to 4 days later. Fortunately, an antidote for paracetamol overdose exists: acetylcysteine, also known as fluomucil, which serves as an expectorant and is used for certain cases of OCD and trichotillomania. This antidote proves effective in safeguarding the liver against paracetamol overdose. However, if you've exceeded the recommended dosage, it's imperative to seek immediate medical attention at an emergency room and explain the situation to the doctor, rather than risking the need for a liver transplant. It's essential to recognize that just because a medication isn't listed here doesn't mean it can't cause liver damage. Vigilance and adherence to prescribed dosages are paramount to protecting liver health. The roster of medications carrying hepatotoxic potential is expansive, encompassing antiretrovirals, vitamins like niacin, various antibiotics, supplements, and even herbal teas, a topic explored in a separate video. Given the liver's pivotal role in bodily functions, any malfunction can have far-reaching consequences. Thus, exercising extreme caution when using medications is paramount to prevent drug-induced hepatitis and, in severe instances, fulminant hepatitis. Fulminant hepatitis represents a grave complication affecting a notable fraction of individuals with acute drug-induced hepatitis, often characterized by symptoms like jaundice and yellowing of the skin. Shockingly, among these cases, only approximately 20% survive without the necessity of a liver transplant. This underscores the critical importance of vigilant medication use and prompt medical intervention to safeguard liver health and overall well-being. The liver, your body's silent warrior, plays a pivotal role in maintaining your overall health. It's akin to an air filter, detoxifying chemicals, and a powerhouse of energy, tirelessly ensuring that your body absorbs the necessary nutrients while protecting you from the toxins ingested daily. Moreover, this vital organ is responsible for producing proteins essential for blood clotting, making it an indispensable part of your existence. In today's segment, we're diving into a crucial topic that everyone needs to pay attention to: foods that are detrimental to your liver's health. Surprisingly, some everyday items on your menu, such as alcohol, raisins, canned foods, and red meat, are among the culprits that can wreak havoc on this crucial organ. Stay tuned as we unravel the dietary choices that could be undermining the health of your liver, and what you can do to turn the tide in favor of your well-being. 1. Sugar. Your body might be asking for that sugar rush, but hey, let's talk about why we need to keep those cravings in check. Overloading on sugar isn't just a no-no for your waistline, it's a red flag for your liver too. Yep, you heard it right. Gorging on too much sugar can set you on a fast track to obesity and diabetes, both of which are VIP tickets to developing fatty liver disease. Now, research is all in agreement here: cutting down on sugar can be a game changer for your liver health, steering clear of fatty liver disease. Here's a sweet fact for you: sugar breaks down into fructose in our body. But when there's too much going on, this fructose gets stored as fat, right in the liver, putting it under more stress. Sugar is pretty sneaky, hiding in everyday processed foods like your favorite cookies, cereals, cakes, juices, and even in those fizzy sodas. And it's not just the obvious culprits. Sugar plays hide and seek in places you'd least expect, like salad dressings and ketchup. Always check the sugar content on labels before you throw anything into your shopping cart. While the natural sugars in fruits and certain foods get a green light for liver health, moderation is key. So, next time you're about to indulge, remember it's not just about counting calories, it's about making every calorie count for your liver's health. 2. Excessive salt intake. Anything taken in excess can lead to harm, and salt is no exception. While salt is commonly associated with elevated blood pressure, it can also inflict damage on various parts of the body. Recent studies have revealed that consuming too much salt can lead to liver scarring. Fortunately, antioxidants such as vitamin C can mitigate this damage. It is advisable to steer clear of high-sodium foods and incorporate new items into your diet. Opt for foods rich in vitamin C, such as strawberries, kale, and bell peppers. Make an effort to avoid processed foods like ham, bacon, and deli meat. Choose fresh vegetables over canned varieties and experiment with using herbs instead of salt during cooking. Additionally, remove the salt shaker from the dining table. 3. Raisins. While raisins are often touted as a nutritious snack, consuming them excessively can have adverse effects. Despite their natural sweetness and some health benefits, including dietary fiber and certain vitamins and minerals, overindulging in raisins can be counterproductive to your health. Raisins are high in sugar, preservatives, and calories. Moreover, they can contribute to inflammation in the lining of your liver if consumed in large quantities. While they may seem like a healthier alternative to indulging in candies like Skittles, moderation is key. 4. Sodas. Sodas, often laden with high fructose corn syrup, pose a significant threat to your liver health. This sweetening agent, commonly found in many soda formulations, is particularly detrimental to liver function. Even if sodas are sweetened with sugar instead, they still pose risks to liver health. One critical function of the liver is to convert sugar into fat. Consuming excessive amounts of any type of sweetener, whether it be high fructose corn syrup or sugar, can overwhelm the liver's capacity to process these sugars efficiently. This excess sugar conversion ultimately leads to the accumulation of fat in the liver, a condition known as fatty liver disease. 5. Fructose. While foods rich in sugar such as raisins and juice may be enjoyable, they can be detrimental to liver health due to their high fructose content. Unlike other sugars, fructose does not metabolize in the body in the same way, posing unique challenges to liver function. Consuming excessive amounts of sugar, including fructose, can lead to dyslipidemia, characterized by abnormal levels of fat in the blood. Studies have indicated a strong correlation between fructose consumption and conditions such as fatty liver and inflammation. While moderate consumption of fruits which naturally contain fructose is beneficial, excessive intake can pose problems for liver health. Therefore, it's advisable to exercise moderation and avoid overindulging in foods like raisins, juice, trail mix, or honey, which are high in fructose. 6. Trans fats. Partially hydrogenated oils, the source of trans fats, continue to persist in many processed foods despite increased awareness of their harmful effects. These oils can be found in a wide range of products such as store-bought frosting, crackers, cookies, salad dressings, and microwave popcorn. Consuming even small quantities of trans fats can elevate levels of bad cholesterol in the body. What makes trans fats particularly concerning is that they are efficiently processed by the liver, leading to a significant buildup of bad cholesterol within this vital organ. This accumulation heightens the risk of liver disease over time. 7. Fried foods. Your liver plays a crucial role in breaking down nutrients, but when it becomes overwhelmed with fats, its efficiency is compromised. Fried foods and other high-fat items can contribute to the development of fatty liver disease, making it advisable to limit their consumption. The excess fat from these foods can lead to inflammation and scarring, resulting in permanent damage to the liver's ability to process nutrients efficiently. 8. Packaged snack foods. When the craving for packaged snacks strikes, consider reaching for a healthier alternative instead. Chips and baked goods, while convenient, are often laden with unhealthy amounts of sugar, salt, and fat. Consuming foods high in sodium can lead to fluid retention in the liver, impeding its function over time. Additionally, many processed snacks contain trans fatty acids, which contribute to the development of fibrosis. This condition involves the formation of scar tissue in the liver, replacing healthy cells and potentially leading to serious complications such as cirrhosis or liver cancer. 9. Fast food. Indulging in your favorite fast food meal may seem satisfying, but it comes with a double dose of health risks. fast foods are typically laden with refined carbohydrates and fats, a combination that spells trouble for your liver health. A diet high in refined carbohydrates can contribute to the development of fatty liver disease. These carbohydrates cause sharp spikes in blood glucose levels and trigger a significant release of insulin, leading to the accumulation of fat in the liver. Moreover, consuming foods high in fats, especially in excess, can raise levels of bad cholesterol while reducing the beneficial kind. This imbalance in cholesterol levels further compromises liver health and increases the risk of related complications. Next time you're tempted by greasy cheeseburgers and other fast food fare, remember the toll it can take on your liver and opt for healthier alternatives instead. 10. Simple carbohydrates. Simple carbohydrates, often devoid of essential nutrients due to extensive processing, pose significant risks to your health. These refined carbs have the tendency to rapidly elevate blood sugar levels, triggering the body to release insulin. Over time, this can lead to insulin resistance, a condition where the body's cells become less responsive to insulin's signals. As insulin resistance progresses, the risk of developing fatty liver disease increases. Common sources of simple carbohydrates include white bread, white noodles, cakes, cookies, pastries, and crackers. Regular consumption of these foods can contribute to metabolic imbalances and liver dysfunction. 11. Alcohol. Alcohol consumption poses a significant risk to liver health, with alcoholic fatty liver disease being a common consequence of excessive drinking. Under normal circumstances, the liver can process approximately one standard drink, equivalent to about 10 to 15 grams of alcohol within an hour. However, consuming alcohol beyond this limit and doing so frequently can lead to the accumulation of fat deposits in the liver. Alcoholic fatty liver disease may not manifest obvious symptoms, making it imperative for detection through medical evaluation such as blood tests or a biopsy. Furthermore, alcohol can exacerbate the progression of pre-existing liver conditions. One of the liver's primary functions is to metabolize alcohol. However, continued alcohol consumption in the presence of liver damage impairs the organ's ability to effectively metabolize alcohol, exacerbating liver damage further. 12. Red meat. Consuming red meat can have negative implications for liver health, particularly for individuals with serious liver conditions like cirrhosis or hepatitis. Red meat contains saturated fats and other substances that may contribute to the development of non-alcoholic liver disease over time. Additionally, the metabolism of red meat places a significant strain on the liver due to its complex proteins and fats. Research suggests that individuals who are overweight and consume high amounts of animal protein, such as that found in red meat, are at an increased risk of developing fatty liver disease compared to those with lower consumption levels. Given these concerns, it's advisable for individuals with liver diseases and those looking to protect liver health to limit their intake of red meat. Instead, opting for lean protein sources like poultry, fish, legumes, and plant-based proteins can help reduce the burden on the liver while providing essential nutrients. Prioritizing dietary choices that support liver health can contribute to overall well-being and mitigate the risk of liver-related complications. Beat fatty liver with these superfoods, a must-watch guide. Today, I'll be sharing crucial information related to dietary habits that can aid in reducing liver fat. Fatty liver disease is a globally concerning health issue. We need a clear understanding of this condition. Solely considering non-alcoholic fatty liver disease, it affects approximately 1.7 billion people worldwide. The prevalence of fatty liver due to alcohol consumption is also significant. Notably, this doesn't include those who develop fatty liver due to alcohol consumption. Both non-alcoholic and alcoholic fatty liver diseases face similar problems but have different causes. Therefore, in today's discussion, I'll elaborate on the foods you should consume to help remove fat from your liver. To complement the previous information, I wish to clarify about foods that can harm the liver. A primary factor here is fructose. Fructose is unique because it's a type of sugar that cannot be processed by all body cells like glucose, but only by liver cells. When you consume high fructose corn syrup or any type of fructose from fruits, your liver is forced to process it. If the liver is overloaded with too much fructose, it can lead to fatty liver, even though fructose is low on the glycemic index. Naturally, any food that increases insulin can also contribute to fatty liver development, including sugars and refined carbohydrates. Other factors like inflammation can also cause fatty liver. Thus, we are facing a cycle that includes inflammation, fatty liver, liver scarring, and cirrhosis. Then there is insulin resistance in the liver, which can increase insulin levels and cause more fatty liver. Ultimately, the condition of fatty liver itself can create more inflammation, worsening insulin resistance. Indeed, it's an unending cycle. If you stand up and can't see your shoes due to your belly, there's a high likelihood of having fatty liver. However, even without a noticeable belly, you can still have fatty liver, known as skinny fat. Remember to subscribe to our channel to stay updated with our latest videos, and if you find our content valuable, please consider making a donation through the donate feature to support us in creating more high-quality content. We need to focus on foods with a high omega-3 to low omega-6 ratio, as omega-3 fatty acids can help remove fat from the liver. Another counterintuitive element is short-chain fatty acids. Despite being fats, they can aid in removing liver fat by significantly improving insulin resistance. The body can produce short-chain fatty acids by consuming fiber that feeds gut microbes. These microbes then produce short-chain fatty acids as a byproduct. Before discussing specific foods, I want to highlight the importance of essential nutrients and plant-based compounds that significantly reduce inflammation, indirectly aiding in liver fat reduction. Curcumin from turmeric, like resveratrol found in grapes, are potent antioxidants. However, consuming grapes can be problematic due to their fructose content, potentially nullifying their benefits. Some may choose to drink wine for its resveratrol, but the alcohol in wine can damage the liver. Thus, these choices aren't genuinely beneficial. However, we have a potent compound in green tea, EGCG. Even in many supplements or spices, such as the phytonutrient thymoquinone in black cumin seeds, are powerful in helping remove fat from the liver. Additionally, fasting and exercise can also reduce liver fat. Vitamin D from sunlight aids in removing liver fat, and vitamins A and E also help reduce liver fat. Regarding diet, let's consider this now. All cruciferous vegetables significantly help reduce liver fat. We're talking about vegetables like arugula, broccoli, Brussels sprouts, cabbage, radishes, and Swiss chard. These are high-fiber, low-carb, low-sugar foods. With their fiber content, another effective vegetable for removing liver fat is dandelion greens. They have a thicker texture and are not as tender as salad greens. They're not just for fatty liver but also for many other liver issues. And then there's salmon, particularly wild-caught salmon. Why wild-caught? Due to its high omega-3 content. Omega-3 fats help strip fat from the liver. However, I found a study indicating that consuming farm-raised salmon could worsen liver fat, so it's best to opt for wild-caught salmon. And finally, olive oil. Olive oil is a specific type of fat that can help get rid of liver fat. Additionally, olive oil is highly anti-inflammatory and contains potent phytonutrients. It's crucial to ensure you're using genuine olive oil, as fake olive oil is common nowadays. Therefore, it's worth investing a bit more in high-quality olive oil to achieve the desired effects. Now, probiotics help get rid of liver fat. This includes probiotic foods like fermented vegetables, particularly sauerkraut, kimchi, and you can also use kefir as a fermented food product to aid your liver. The next two vegetables I'll include, based on the research I've found, are garlic and onion. Both have powerful effects on removing liver fat, so definitely start incorporating more garlic and onion into your meals. And the last one is not exactly a food, but a drink, coffee. Believe it or not, coffee has the potential to help you strip fat off your liver. Of course, I recommend limiting it to 1 cup a day due to the excess caffeine that can cause sleep disturbances. However, chlorogenic acid and other chemicals in coffee, including caffeine, help reduce liver fat. Green tea and black tea can also help reduce liver fat. Today, we're going to delve into 6 unusual signs that could indicate liver damage, and no, it's not just excessive alcohol consumption that's to blame. A multitude of factors can lead to liver issues, from your diet, changes in your lifestyle, to having a fatty liver, among other causes. The worrisome truth is that most people only discover liver problems when the condition has become severe and requires significant medical intervention or surgery. To avoid finding yourself in such a predicament, being aware of the early signs and symptoms of liver damage is crucial. Stay tuned to find out what your liver might be trying to tell you. Diving into the realm of liver health, let's examine our first indicator, the yellowing of the skin and eyes, a condition medically termed jaundice. It may seem peculiar at first, but it's a critical signal that warrants your attention. Our liver tirelessly filters out a substance known as bilirubin, a byproduct of the body's regular breakdown of aged red blood cells, characterized by its yellow pigment. When the liver is compromised, it struggles to process bilirubin, causing an accumulation in our system, which then manifests as the distinctive yellow hue on the skin and in the whites of the eyes. Let's unpack this further. Under normal circumstances, the liver effectively processes bilirubin and disposes of it via bile. However, liver damage impedes this process, leading to an increase in bilirubin levels in the bloodstream, evident through the yellowing associated with jaundice. It is crucial to acknowledge that jaundice itself is not a disease but a symptom signaling potential liver dysfunction. If you observe such changes in your skin or eye color, it's indicative of a liver that may be under distress, and obtaining medical consultation without delay is advisable. Detecting such symptoms early can profoundly influence the approach and success rate of treating liver-related health issues. Now, let's shift our focus to a symptom that's often brushed aside: unexplained fatigue. We've all been tired at one time or another, but the exhaustion associated with liver damage is in a league of its own. Consider the sensation of perpetual exhaustion, an enduring need for rest regardless of ample sleep. This type of fatigue could be a telltale sign that your liver may not be up to par. To understand why, we need to delve into the liver's role in energy production. Our liver is the storage house for glycogen, a form of sugar that is converted into energy as our body demands. If the liver is impaired, this conversion process is disrupted, leading to a persistent state of fatigue. From a medical perspective, such fatigue is often tied to increased levels of liver enzymes in the blood, pointing to liver inflammation or damage, as well as a reduced capacity for protein synthesis, which is crucial for health and energy. If you're experiencing a level of tiredness that doesn't seem to recede with rest, it might be more than just a bad night's sleep. It could be a signal from your body that your liver health needs attention. This symptom should not be overlooked. Early intervention is vital for preserving your health. If this unrelenting fatigue sounds familiar, it's wise to seek a healthcare provider's insight to investigate the underlying causes. Advancing to our third unusual sign, persistent itchy skin. Occasional scratching is normal, but when the itch doesn't go away, it could be more than a simple case of dryness. The liver plays a pivotal role in our skin's well-being. A dysfunctional liver may lead to an excess of bile salts in our bloodstream, which in turn can cause persistent itching. To get into the specifics, bile salts are compounds produced by the liver that aid in digestion. However, when the liver is damaged, these salts can build up and migrate to the skin, resulting in a relentless itch. In medical terms, an increase in bile salts often points to liver issues. If you're experiencing an unusual amount of itching that doesn't seem to subside, it may be a subtle warning from your liver. Itchy skin, while often overlooked, can be a crucial indicator of an internal imbalance. Consulting a healthcare professional is a prudent step to uncover the cause of your itchy skin and to check for any liver-related concerns. Addressing these signs early on is crucial for effective management and prevention of more serious health problems. Turning to our fourth unusual sign, let's talk about dark urine. It may feel odd to monitor the hue of your urine, but its color is actually a significant indicator of your liver's condition. Typically, urine should have a pale yellow shade. If it starts to appear consistently darker, this may be a warning that your liver is struggling. Dark urine often indicates a problem with the liver's processing of bilirubin. Think of it as a cautionary signal from within. While it's not necessarily a reason for immediate concern, it's an alert that shouldn't be ignored. Persistent dark urine warrants a conversation with a healthcare provider. A professional can carry out the necessary examinations to pinpoint the exact cause and preempt any liver-related problems from worsening. Keep in mind, catching any health issues early can be crucial for effective treatment and long-term well-being. Remember to subscribe to our channel to stay updated with our latest videos, and if you find our content valuable, please consider making a donation through the donate feature to support us in creating more high-quality content. Addressing our fifth distinctive sign, pale or clay-colored stools. It's not a subject that's typically discussed at the dinner table, but the appearance of your stools is a surprisingly telling indicator of liver health. Under normal conditions, a pigment called bilirubin, produced by the liver, imparts stools their characteristic brown color. When the liver is healthy, it processes bilirubin effectively, which in turn colors the stools. However, if there's a liver malfunction, it may not process bilirubin properly, and this is reflected in pale or clay-colored stools. Put simply, a lack of color in your stools may suggest a hiccup in this coloration process, a visual hint that your liver might not be functioning optimally. Medically, a lighter stool color corresponds with reduced bilirubin content, which could signal liver dysfunction. While discussing stool color might be somewhat uncomfortable, being observant of such changes is crucial for early detection of liver conditions. Should you notice a consistent presence of pale stools, it's wise to seek medical advice to investigate your liver's health. Prompt action can be a key factor in managing liver health and safeguarding your overall wellness. Discussing our sixth and final peculiar sign, bruising easily. Bruises are common, yet if you're experiencing more frequent bruising with little to no impact, it may point to an underlying issue with your liver health. Our liver is instrumental in producing proteins that are vital for blood clotting. If the liver is compromised, its ability to synthesize these proteins diminishes, thereby increasing your susceptibility to bruising. To put it in layman's terms, the proteins your liver produces act as the body's internal repair team, aiding in stopping bleeding and healing bruises. When liver function is impaired, this repair crew isn't as effective, which means bruises may appear more readily. From a clinical standpoint, a propensity for easy bruising is often related to a decrease in the liver's production of clotting factors. Therefore, if you're noticing bruises cropping up more often, particularly from minor or negligible trauma, it's a good idea to seek a medical evaluation. A healthcare provider can check your liver function and advise on next steps to manage and mitigate any issues. 7 Natural Strategies for Effective Liver Detoxification. Today, we delve into the science of naturally detoxifying and cleansing one of the human body's most crucial organs, the liver. Are you prepared for this enlightening journey? Let's embark on it together. The liver, an organ of paramount importance in the human anatomy, primarily functions to eliminate toxins produced daily by our bodies. In modern diets, heavily laden with processed foods and synthetic additives, the liver is often burdened, necessitating increased efforts to maintain optimal functionality. At this juncture, the question arises, is it feasible to detoxify the liver? Briefly, yes, it's possible, but it's imperative to approach this topic with discernment. A cursory internet search reveals a plethora of liver detox products, including vitamins, pills, teas, and oils, all claiming rapid and significant results. However, the efficacy of these products remains a topic of debate. While I cannot categorically comment on their effectiveness, I urge you to conduct thorough research on their ingredients and consult your healthcare provider before starting any supplement regimen. It's noteworthy that many liver detox products on the market are not approved by the Food and Drug Administration, FDA, a fact that warrants consideration. In this discussion, our focus will be on natural foods and supplements that can aid in liver cleansing. I strongly advise seeking medical counsel and not initiating any dietary or supplement changes without prior consultation with your healthcare provider. With this crucial advisory in place, let us explore how to naturally detoxify your liver. Firstly, let's discuss the critical role of dietary fiber in liver health. Fiber, a vital component for optimal digestion, plays a significant role in aiding the body's natural detoxification processes. Regrettably, many modern diets fall short in fiber content as foods are often processed, stripping them of their natural, beneficial fiber. This deficit hinders the body's ability to eliminate toxins efficiently. In the absence of adequate fiber, toxins accumulate, burdening the liver, an outcome far from desirable for liver health. To counteract this, one can effectively support liver function by simply increasing fiber intake. Incorporating a variety of fruits and vegetables into your diet is a straightforward strategy to enhance fiber consumption. This not only contributes to a more balanced diet but also provides substantial support to liver health. I understand that not everyone enjoys fruits and vegetables, particularly if you have selective eating preferences. For those who find it challenging to incorporate these into their diet, there are palatable and healthy alternatives. Secondly, let's consider the habitual consumption of green tea, a beverage with numerous health benefits. Many of us rely on caffeine to navigate through our daily routines. While there are various sources of caffeine, green tea stands out due to its unique health properties. Green tea is rich in catechins, potent antioxidants that offer substantial benefits to liver health. Regular consumption of green tea, ideally 2 to 3 cups daily, can aid in detoxifying the liver. In addition to liver health, green tea contributes to a myriad of other health benefits, making it a valuable addition to your daily regimen. Thirdly, let's talk about incorporating garlic into your diet. Garlic, a well-regarded ingredient across various cultures and cuisines, is not only flavorful but also packed with health benefits. It contains essential amino acids and compounds that activate liver enzymes, facilitating the removal of toxins from the body. Additionally, garlic is a source of selenium, a potent antioxidant. Introducing garlic into your cooking is an effortless yet effective way to support liver detoxification. While some may find the taste of garlic strong or unappealing, garlic supplements are a viable alternative. Moreover, vitamin C is instrumental in the synthesis of certain enzymes. These enzymes are vital for the liver as they facilitate the elimination of toxins. The liver's ability to process and remove harmful substances from the body is greatly enhanced by the presence of these enzymes, which are supported by adequate levels of vitamin C. Therefore, incorporating citrus fruits into your diet can have a dual benefit, boosting your immune system and supporting liver function. This can be achieved by including these fruits in your daily meals, whether as part of breakfast, as a snack, or even incorporated into salads and other dishes. Fifth, let's consider turmeric, a spice celebrated worldwide for its flavor and health benefits. Originating from Asia and a staple in Indian cuisine, turmeric's therapeutic qualities have gained recognition recently. Personally, I vouch for its positive impact on health. While turmeric offers numerous health benefits, its role in liver health is particularly notable. It is believed to stimulate the regeneration of liver cells. However, it's important to remember that turmeric should complement, not replace, medical treatments prescribed by your doctor. To incorporate turmeric into your diet, use it as a spice in cooking, or add it to tea or milk. While my preference is to take turmeric supplements, it also enhances the flavor of dishes like curries and stir-fries. Number 6. Incorporating nuts into your daily diet presents numerous benefits for liver health, a fact that is often overlooked in discussions about nutrition and wellness. Nuts, and particularly walnuts, are a powerhouse of nutrients essential for the optimal functioning of the liver. Let's delve into the specific components that make nuts, especially walnuts, so beneficial. They are abundant in proteins, which are vital for repairing and building liver cells. Proteins also play a key role in the synthesis of enzymes that the liver uses in its detoxification processes. Amino acids, the building blocks of proteins, are another crucial component found in nuts. They assist in various liver functions, including detoxification. Arginine, an amino acid present in nuts, is particularly noteworthy. It aids in the liver's detoxification process by helping to neutralize ammonia, a byproduct of protein metabolism. Moreover, walnuts are a rich source of omega-3 fatty acids. These essential fatty acids are known for their anti-inflammatory properties, which are beneficial in managing liver inflammation and promoting overall liver health. Omega-3s also help in reducing the accumulation of fats in the liver, thereby preventing conditions like fatty liver disease. The recommendation is to include a daily handful of nuts, preferably organic and unprocessed, in your diet. The emphasis on organic and unprocessed varieties is due to their higher nutritional value and absence of harmful additives or preservatives, which could otherwise counteract the liver protective benefits. Finally, the 7th recommendation is to increase your consumption of leafy green vegetables. These vegetables, which include spinach, kale, lettuce, broccoli, cabbage, and bok choy, are not only high in fiber but also contain compounds that aid the liver in breaking down larger molecules, facilitating easier toxin elimination. Incorporating these vegetables into your diet can lead to noticeable improvements in your energy levels and overall well-being within a week. In conclusion, you are now equipped with knowledge on how to naturally detoxify your liver, an essential organ with remarkable functions. The liver's ability to process and eliminate toxins is indeed a marvel of human physiology, underscoring the importance of maintaining its health. The dietary components we've explored in this session are specifically chosen to support and enhance liver function. These include high-fiber foods, antioxidants, and nutrients essential for liver health. Each item we've discussed plays a unique role in aiding the liver's detoxification processes, thereby contributing to overall health and well-being. However, it is crucial to approach any dietary changes or supplement introductions with caution. I cannot overstate the importance of consulting with your healthcare provider before making any adjustments to your diet or health regimen. This is especially true if you have pre-existing health conditions or are on medication, as even natural foods and supplements can interact with medicines and affect your health. Our goal is to enhance awareness, and unfortunately, these common foods are often found in restaurants you may frequent, where the cheapest ingredients are used. For instance, children's menus typically include the worst possible food choices, containing maltodextrin, a substance worse than sugar, though not classified as such, and inexpensive oils like soybean and corn oil. You might be unaware that you're ingesting these substances, leading to bloating and discomfort post-consumption. There are 3 primary issues the liver can face: inflammation, fatty liver disease, and scarring, which can progress to cirrhosis. Observing someone with cirrhosis, their skin condition appears unhealthy. They might look thin but have a distended abdomen, a condition known as ascites, resulting from the liver leaking fluid into the abdominal cavity. This indicates severe liver damage. Often, their skin and the whites of their eyes turn yellow, a symptom of jaundice. Alcohol is a significant contributor to liver damage, but many are suffering from non-alcoholic fatty liver disease, with statistics alarmingly rising, especially among children. Therefore, we will review which foods to avoid and which can help reverse these conditions. Remarkably, the liver possesses a strong regenerative capacity, though there is a limit to this recovery. Let's start with number 1. TV dinners. The number 1 culprit on our list of liver-damaging foods is TV dinners, a category that might have once held a special place in your heart. The convenience and the comfort of a pre-packaged meal can be enticing, but a closer look at the ingredient list reveals a different story, an alarming one. For instance, take a classic like meatloaf, a dish you might adore, especially when following a beloved family recipe. However, in your college days, a lack of attention during the cooking process could lead to an unforgettable experience. Mixing a pound of hamburger meat with white bread and ketchup, and then consuming it all in one sitting without draining the excess grease, results in an overwhelming intake of fat and sugar. The aftermath could be a painful wake-up call in the early hours, marked by a severe gallbladder issue. At the time, you might be unaware of the cause, mistakenly believing over-the-counter medication might offer relief. This personal anecdote highlights a broader issue with TV dinners. They often combine carbohydrates with meats in ways that promote the formation of advanced glycation end products, AGEs, exacerbating liver and gallbladder problems. The inflammation from such dietary choices further leads to insulin resistance, increasing blood sugar levels and contributing to the accumulation of visceral fat around the liver and ectopic fat within the liver itself. This ectopic fat exists outside the fat cells, infiltrating the organs and impairing liver function. Typically, TV dinners include ingredients like modified food starch, wheat flour, dextrose, modified corn starch, and, of course, sugar. These components, when combined and consumed, pose significant risks to liver health. Thus, despite their convenience and taste, TV dinners are far from being the best option for maintaining a healthy liver. Number 2. Tomato soup. The second food item that can negatively impact liver health is tomato soup. While tomato soup is singled out here, it's important to note that similar issues may arise with other types of soup as well. Upon inspecting the ingredients of a tomato soup, which used to be a staple in my diet, it's clear that it's not just made of tomatoes. There's a significant amount of sugar and wheat flour, along with other chemicals. In just a half-cup serving, which amounts to 4 ounces, there are 4 teaspoons, 16 grams, of sugar. It's uncommon for anyone to limit themselves to just half a cup. Consuming an entire can is more typical, effectively doubling the intake to 8 teaspoons of sugar. This excessive sugar consumption leads to fat accumulation, inflammation, and oxidative stress in the body. Such high levels of sugar, especially when hidden in seemingly innocuous foods like tomato soup, can be particularly damaging to the liver. The liver processes all the sugar we consume, and overloading it with high-sugar foods can lead to conditions such as fatty liver disease and contribute to the overall burden of liver damage. Number 3. Nachos. The third item on our list of foods detrimental to liver health is nachos. In college, you might grab a can of cheese sauce and pour it over chips, topped with salsa. The chips themselves are a concern, made from corn flour that's typically genetically modified, GMO, and treated with glyphosate, among other chemicals. Then there's the matter of the oils used in their preparation. As for the cheese sauce, finding actual cheese in there might be a stroke of luck. Additionally, consider the scenario of visiting a fast food restaurant where deep frying is a common practice. The frequency of oil changes in these establishments can be alarmingly low, with some using the same oil for weeks, or even months. Consuming food fried in such overused oil can inflict considerable oxidative stress on your cells, especially since the fried items are typically carbohydrate-rich. This combination of genetically modified ingredients, harmful chemicals, and the oxidative damage from repeatedly used frying oils underscores the risk nachos pose to liver health. The repeated exposure to these factors can exacerbate inflammation and contribute to the accumulation of damage in the liver and other tissues. Number 4. Fried foods. Fried foods represent a significant threat to liver health. When indulging in these crispy delights at restaurants, it's unlikely they're fried in healthful oils. Instead, they're submerged in seed oils such as corn, canola, cottonseed, and soy oil. These oils are genetically modified organisms, GMOs, exposing consumers to glyphosate, a controversial herbicide known for its inflammatory properties. Beyond inflammation, these omega-6 rich seed oils infiltrate our tissues, integrating into our cell membranes. This invasion spells trouble down the line, particularly when these oils contribute to the brittleness and inelasticity of arterial walls. A prime example of the dangers posed by fried foods is the humble potato chip. Potatoes are sliced, soaked in oils like vegetable or cottonseed oil, curiously named, as cotton is hardly a vegetable, and then fried. The process of frying, especially at high temperatures, with starches like those in potato chips, leads to the formation of advanced glycation end products, AGEs. This reaction occurs when fats bond with sugars, a transformation that can lead to inflammation in the liver and other tissues. Consider the ingredients in many commercial potato chips: potatoes, a variety of vegetable oils including corn, cottonseed, and soy, along with corn flour, rice flour, maltodextrin, and wheat starch. These components, especially maltodextrin, can significantly spike blood sugar levels, with a potential glycemic index value exceeding 100. This rapid conversion to sugar not only elevates blood glucose but also encourages the storage of fats in the liver, further compromising liver health. Yet, despite these health implications, the addictive taste of potato chips makes them irresistible to many. The combination of flavors and textures makes it challenging to stop at just one chip, leading to overconsumption and, consequently, a higher risk of liver damage. Number 5. Meat products. The fifth category of foods that pose a threat to liver health is meat products, particularly processed and canned meats. Reflecting on my college days, financial constraints led me to frequent discount grocery stores where I would purchase budget-friendly options like 4-meal chilies and various canned meats. I'm not referring to healthier choices like sardines or canned tuna, but rather to canned meats such as Spam and similar products. These canned meats often include added ingredients like corn flour, modified corn starch, and textured soy flour. These additives are problematic because, similar to fried foods, when carbohydrates are mixed with fats or proteins, they lead to the formation of advanced glycation end products, AGEs. This glycation process can severely impact liver function by clogging it up. The ramifications of consuming these processed meats extend beyond the liver, potentially affecting tissues in the eyes, heart, arteries, and brain. This not only exacerbates inflammation throughout the body but also spikes insulin levels, leading to increased fat production. Therefore, alongside fried foods like chips, canned and processed meat products are major contributors to liver damage due to their unhealthy additives and the harmful chemical reactions they induce in the body. Number 6. Aflatoxins. The sixth and final item on our list involves exposure to aflatoxins, a type of mold known for its potential to cause liver cancer. This mold is more commonly encountered in Asia or Africa, particularly in cereals, legumes, and grains stored in conditions conducive to mold growth. However, certain precautions can minimize the risk of aflatoxin exposure. For instance, opting for Valencia organic peanut butter, which is less likely to contain aflatoxins, is a safer choice. This specific type of peanut butter is what I choose to enjoy with my celery. Moreover, steering clear of grains can also reduce the risk of encountering aflatoxins. Turning our attention to foods beneficial for liver health, cruciferous vegetables like kale, broccoli, arugula, Brussels sprouts, and bok choy are excellent for supporting liver regeneration. Essentially, any raw vegetables can be considered liver-friendly. Additionally, a moderate intake of high-quality, grass-fed protein plays a crucial role in liver health. Eggs are particularly beneficial due to their high choline content, which aids in reducing liver fat. Incorporating foods rich in omega-3 fatty acids, such as cod liver oil and fatty fish like salmon, can also support liver health. On the other hand, refined foods, especially those that are cooked or preserved, should be avoided as they can be detrimental to liver function. Number 7. High fructose corn syrup, HFCS. The seventh item on our list encompasses a broad category of foods containing high fructose corn syrup, HFCS. It's crucial to understand that the fructose found in HFCS differs significantly from the fructose present in fruits. Despite being the same molecule, the context in which fructose is consumed matters immensely. HFCS is a highly processed product derived from corn, manipulated in a way that strips away any beneficial components. In contrast, fruit comes with various protective nutrients that can safeguard against health issues like diabetes. High fructose corn syrup doesn't offer these protective benefits. It's found in products that can be considered liquid candy, such as sodas, as well as in jellies, ketchup, candies, bread, applesauce, maple syrup, agave nectar, whipped cream, and many more. Among all the sugars detrimental to liver health, fructose sits at the top of the list. The liver metabolizes fructose similarly to how it processes alcohol, as a toxin. This can lead to serious health problems, including insulin resistance, fatty liver disease, and liver inflammation, which may eventually progress to cirrhosis. Therefore, it's evident that fructose, especially in the form of high fructose corn syrup, is a major contributor to liver damage. Being mindful of HFCS content in foods and choosing alternatives with natural or less harmful sweeteners can play a crucial role in protecting liver health and overall well-being. Prioritizing a diet rich in whole foods and protective nutrients is key to maintaining a healthy liver. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.